Thanks for watching AM Northwest this morning. Groundbreaking research at Western Oregon University could change the way we treat children with autism. And here to tell us about the amazing results of a recent study, we welcome back Dr. Louisa Silva, along with two mothers who took part in the program, Crystal Clover and Erin McMullen. Good to have you all with us. So let me have you, Doctor, explain the program, how it worked, the study.
Okay. Well, autism is a spectrum, and there are children who have a lot of language and not very much language, but the common denominator in all the children is that they're not social. They don't enjoy social contact and they avoid it.
And
so,
they don't enjoy physical contact either,
exactly.
Right?
And so when the experts changed the diagnosis of autism 2 years ago to include sensory problems, they opened up the question of whether all the touch problems that children have something to do with autism. Because when you think about it, social development begins with touch. If you imagine the mother and the baby and all the face-to-face and skin-to-skin. And children with autism don't like touch. They avoid it, they don't enjoy it. Our research for the last 15 years has been to develop a family-based treatment to normalize the sense of touch. And we have, and to treat autism that way. And so we've done over 12 studies, and we've developed this massage. We train the parents to give the massage. We give them weekly support. It's not easy to do at first because their children resist, but they learn and they do it well. And it really works. Within a few months, the touch problems are about 50% better, and the children are changing. That door to social development is opening. They are listening to their parents. Their behavior is calming down. They are seeking out affectionate touch. They're getting closer to their siblings, and their autism scores are going down by about 30% in 5 months.
How often are parents giving them their
They give
children?
it every day.
Every
These
day.
mothers
Once
have
a day,
given it
twice a day?
Once a day. Some of them give it twice a day, but we ask for the study that they give it once a day. It takes about 15 minutes.
And are you blown away by the results?
It's the first treatment that affects all the problems in autism, social, language, and sensory.
Okay.
And it's the only treatment that affects severe children as well as mild children.
Wow.
You don't have to have language to have success with this.
Right. Moms, tell me your story. Let's start with you.
Well, my son is on the severe side. When he was born, he didn't like to be swaddled, didn't like to be changed, couldn't hold him, couldn't hug him.
Wow.
And we started this 2 years ago. And
how old was he when you started this?
3.
3, okay.
He was 3. And at that time, it was don't touch me, don't hold me, don't dress me. He has no language. He's still in diapers. But we have made huge strides. He, in fact, we noticed after about 5 months of doing this, 6 months of doing this, my mom came over and she was hemming a skirt for me. And he walked up to my mom, sat in her lap, grabbed her face, looked at her and says, "Hi."
Wow.
We were all floored. We were, of course, all in tears. But now we can go into stores. We can go into restaurants.
How long do you think you'll keep up the massage?
Every day. He actually asks for it.
Oh.
So we give it every day, right before bed.
How long is it?
About 15, 20 minutes.
Okay.
And in the mornings, there's times he'll come either to me or Daddy and want his legs squeezed or his arms squeezed.
Wow, going from somebody that didn't want any touch at all. Okay, so Erin, tell me your experience with your child.
My son is on the opposite end of the spectrum. He has always had a pretty fantastic vocabulary, but he didn't want to communicate with peers. That was primarily his issue. He also didn't like being looked at. He would cry if people looked at him in the store. He'd hide his face. And now, after having done the massage for 2 years, he has these full-on conversations, looking people in the eye. He will engage children on the playground. He'll actually go up to them and ask them to play with him. And he's turned into this vibrant, happy, really comedic kid. It really brought out this whole new personality.
And how old was he when you started this 2 years ago?
Just before his 6th birthday. We just made the cutoff for the study, and I'm so glad we did.
Were there times that you felt like this isn't going to work or it's difficult? Did you find it challenging?
At the beginning, it is challenging. The kids are so resistant to that touch. They squirm around a lot.
And it looks like you do it with their clothes on. So their clothes are on.
Yes.
And did you get special training then, I'm assuming?
Yes, we got training from Dr. Silva, and also we had support therapists come and visit us regularly and be there for us while we did it, refresh our memory on the techniques.
Right. Doctor, what would you suggest to parents out there who have children on the spectrum?
If they're interested in,
Right.
in this, I would suggest they contact our website. We have a book. We have trained therapists now throughout the country. We even have some trained therapists overseas. And they can inform themselves about it and see if it's something that they want to do. It is quite a commitment. It's not, you want to do it at least for the first year.
Okay.
And you need to do it every day. But it's a commitment.
And are there
that-
special, I mean, I'm just thinking, someone at home right now is watching this and saying, well, you know what, I'm going to try giving my child a massage in the morning and see how that works. But you need to be specially trained. Are there certain things you need to know, or
We
no?
created a book and a DVD for
Okay.
parents who are at home and don't have access to a therapist.
Okay.
You can teach yourself, and I have had contact with many parents that have done it that way and have had some lovely results with their children.
How long do you think you can keep up the massage sessions
These
going?
moms are doing it every day, and they're going into past 2 years. I think that what
Do you
happens...
think up into their teens? It's
Well,
That might
I
be too little
think
too old?
several years.
Okay.
Several years. I think children will ask for it when they need it.
right. Fantastic. You must be just completely happy with all the results, the positive results you've seen.
It's so nice to see families doing better.
Yeah, absolutely. I want to tell folks that we're going to put all the information on our website at k2.com, and you can find out more about the research and the DVD and the book and all of that. Thank you all very much, and congratulations.
Thank
That's
you.
great news.